And with that, I think it's now time for
Sick of the week. Sick of the week. I'm exhausted because sick of the week is once again bird flu. Oh, bird flu. You really decided to cause some trouble over the holiday break, and now we got to catch up. Okay, here we go. California declared a state of emergency in regards to bird flu. And in my opinion, this is appropriate and good. California has the most infected dairy herds and the majority of human cases, largely from exposure to those herds or poultry farms. Declaring a state of emergency means that they have more flexibility to allocate resources to addressing the issue, which they should have started doing a while ago, but okay. It does not mean that the threat to the general public has changed. That is still very low. We also, over the break, had our first severe case of bird flu in a person in the U.S., in Louisiana. The 66 or so other cases that we've had in the U.S. have been relatively mild and mostly in people who have direct contact with dairy cows or poultry farms. And unfortunately, it was reported on January 6th that this person has died, making it the first bird flu death reported in North America. So in this case, this person was exposed to infected birds as a part of wild birds that had come into contact with their backyard chicken flock. They had the strain of bird flu that is found in wild birds, not the strain that is found in dairy cows. Those variants are, slightly different. Though both of these variants fall under the same clade that has been causing the increase in cases in wild animals since 2021 or so. It's unfortunately not surprising that we have had a severe case. Typically, the relatively rare cases of H5N1 we've seen in humans before have been pretty serious. And there's simply so much bird flu circulating, both in dairy farms and wild bird populations. It feels kind of unfortunately inevitable. Frankly, it's been odd that the cases in the dairy farm workers have been so mild. But that could be a factor of who's getting infected. They tend to be young and physically active, or how they get infected, which we're not totally sure about right now. So the concern really is that both this person in Louisiana and the teen in British Columbia who was critically ill were seen to have mutations to their particular bird flu virus that could improve the virus's ability to bind to cells in the upper respiratory tract of humans. Our saving grace for H5N1 outbreaks so far have been that it does not transmit well between people, but if it developed the ability to both bind to cells in the upper respiratory tract, it could make it easier to infect people. The virus would also need to develop a mutation to allow it to replicate in the upper respiratory tract, not just infect it. But increasing its affinity for human hosts in any way, is not great. Thankfully, neither patient, the one in Louisiana or British Columbia, seemed to have passed the virus on to anybody else. So I do want to be clear. I think it's a matter of when and not if when it comes to the virus infecting more people. The real question is going to be, what will that look like? Is it going to look like the COVID pandemic, or is it going to look like the swine flu pandemic? Or is it going to look like something else? People have talked about how bird flu has a very high case fatality rate. There have been about 900 cases since it was first discovered in 1997, and half of them have died. But none of the cases that we know about from exposure to the cow variant have died. That's important to note because that's kind of the variant that is coming most into contact with people right now. So I just want to make that clarification. I also really want to caution against these sort of statistics causing a panic spiral. One, because the case fatality rate is likely overestimated. The most severe cases are the ones who seek care, which means that milder cases have the potential to be excluded from the denominator if they recover on their own, if they're never captured by surveillance. And two, if the virus mutates to become more transmissible, we don't know if that will also include mutations to be less severe or change its severity. I think COVID taught us that trying to make predictions about the severity in either direction is really hard. So the best thing to focus on right now is prevention. The fewer cases in human, the less opportunity for mutation. It is not too late to get your flu vaccine. Hand washing is a great habit, especially with noro cases on the rise. And masking. I must remind you that we seem to have eliminated the Yamagata strain of influenza B as a result of COVID mitigation strategies. So people can grouse all they want about COVID interventions, even though they work, but you really can't deny that they work extremely well against flu. In terms of vaccines, we do have what are known as candidate vaccine viruses, CVV, for H5N1 vaccine. It's basically a template that can be used to produce vaccine. The question, though, is if any of the existing ones are the proper match to a version that would be spreading between people, or if we'd need to develop additional CVVs when this happens. So far, the mutations that we've seen in the critically ill patients don't differ that far from the CVVs that we have. My bigger concern is that traditional flu vaccines are made in chicken eggs. So if there is a virus that is killing chickens that lay eggs, that could cause a supply chain issue. Work is happening to try to develop an mRNA vaccine for H5N1, and that could circumvent this issue. We're not currently vaccinating anyone. An argument could be made to vaccinate people who work on dairy farms or poultry farms, as they have the highest risk of contact. But given that vaccines would still be considered experimental, and it's not clear what the risk-benefit trade-off would be because we have not yet had enough human infections to do a trial that would tell us information about efficacy. And just a last little note for pet owners, there have been 2 brands of raw pet food, Monarch Raw Pet Food in California and Northwest Naturals, that have recalled their products due to contamination with bird flu. An indoor house cat in Oregon has also died after drinking infected raw milk. So I would really recommend against feeding your animals raw or freeze-dried foods, because freezing viruses is a really good way to preserve them, or unpasteurized milk, just like I would advise you against eating raw poultry and unpasteurized milk, okay? Lastly, quick note about HMPV in China. This is human metapneumovirus. People are freaking out of it because there is a spike in cases in northern China in children, and people are freaked out because they worry that this has pandemic potential. And I just want to let you know, like, people who work in infectious disease or public health are not freaked out about HMPV. It's been around since 2001. It's a virus that peaks in winter months. There is nothing about this outbreak that indicates it's abnormal. Viruses have spikes. I think people are understandably very sensitive to disease outbreaks, but not everything has pandemic potential. People quickly forget that there was a lot of anxiety last year when China had an increase in Mycoplasma pneumonia cases. That did not materialize to be anything in the United States. It's sort of like if people in China started freaking out about a norovirus pandemic because we're having a spike in norovirus cases in the US, which we are. So you should wash your hands. All right, so this week I'm giving the Sick of the Week to bird flu, I guess. Again, congratulations. You're the Michael Phelps of Sick of the Weeks, I guess.
5-timers club.
Yeah.